Welcome to the Whitman and Hanson Councils on Aging seminar, although it's not really a seminar, it's more just a little chat here, about the Senior Medicare Patrol to help you folks out there who are seniors and you who assist seniors to discover whether or not there is any Medicare type fraud going on in your bills or your statements coming back from Medicare. This was supposed to be Mary Collins and Mary Holland asking questions of Dennis today, but Mary Collins was not able to be with us, so it's going to fall entirely on Mary Holland's shoulders to ask all these questions, and she is asking them of Dennis Hohengasser, who is a volunteer with the Senior Medicare Patrol. So, Mary, would you like to ask Dennis the first question?
Sure. Dennis, can you tell us what Senior Medicare Patrol program does and about the program's mission, please?
Sure. The Senior Medicare Patrol is federally funded. It exists in all 50 states as well as the territories. In Massachusetts, we are based out of, although I live in Taunton, the program is based out of Elder Services of Merrimack Valley up in Lawrence. In Medicaid, our goal is to reach, educate, and counsel Medicare and Medicaid beneficiaries, their family members, their caregivers, to protect, detect, and report any fraud, waste, and abuse with Medicare or Medicaid. And when we talk about fraud and abuse, we are not talking about Medicare beneficiaries perpetrating this. We are the victims of fraud and abuse. And that's what we focus on when we do a seminar with folks. In Massachusetts, our vision is to promote consumer engagement, to be an engaged healthcare consumer. Take responsibility for your healthcare, all the services that are being provided for you, and the bills that eventually will come across Medicare's desk. As a matter of fact, Medicare spends somewhere about $600 billion a year paying claims. 10% of that, and this is probably even more than that, 10% of our Medicare budget goes to fraud, waste, and abuse. That's $60 billion a year. It is a ton of money. And we are the first line of defense to protect Medicare from fraud, waste, and abuse.
So, sorry, Mary, I just had a thought for a question there. What would happen to Medicare if none of this fraud was ever discovered?
Well, we hear a lot about the funding for Medicare and that, what the longevity for it is. We want to keep Medicare around as long as we can. And the more we can protect, detect, and report errors and abuse, the longer it'll be with us.
Okay, Mary, continue with your thought. I have to get these things out or I'll forget them, Talk about senior moments.
I was just going to ask, who funds the SMP program?
Well, we are federally funded through the Department of Health and Human Services at the federal level, and through a group called the Administration for Community Living out of Washington, D.C. So we're a federally funded program.
Okay. Can I ask, when you get a report of a possible healthcare error, abuse, or fraud, what happens?
We listen to the complainant and find out just basically get the basic information, and then we enter it into a national database. We have the complainant sign a release form, which gives us access to their information, so we can pursue the case. And we have roughly, there's about 40 volunteers statewide, but some of us do presentations, like I'll be doing. We'll talk about a little bit later in Whitman. But we also have folks who do claims resolution. They look at the claim, they do all the research that has to be done. They call the folks that need to be called, either in other agencies or back to the individual, maybe to a provider, and to find out what the situation is, and they work through the claim that way. It can be a very quick one. It could take a matter of days to solve the problem with a few calls. It could take months, and we've had some that have taken over a year to process to get the payment back from the provider back to Medicare, and to clean up the health records of folks.
Okay.
So then this is actually not only just preserving the Medicare funding, it's also helping people keep their medical records straight.
Yeah, and that's very important. You don't want somebody else's medical records as part of yours. It has to do with some of it has to do with billing. If somebody got a hold of your Medicare number and billed under your Medicare number for, say, a brace of some sort, and what happens is for a lot of these braces and other types of equipment like that, durable medical equipment, they're good for so many years. So if all of a sudden 2 years from now you need a brace, the same brace that was billed for under somebody else, they're going to say that, I'm sorry, ma'am, sir, we've already provided that brace. And you say, no, you didn't. It was a misbilling. Well, it's important to keep your health records safe and secure and accurate.
I do know that we had someone here that had reached out to our outreach coordinator that scenario. They were billed for a brace that they didn't need, didn't have, didn't get, so forth. So it definitely happens.
Yeah, the brace thing is a big thing.
Yeah.
I mean, we've seen the ads on TV. You may be eligible for a brace. You may be eligible, but you may not need one.
Exactly. So if somebody has a discrepancy that they notice on a medical bill or on a summary notice or on their explanation of benefits, who should they call?
I would start with a provider. Call the provider. It may be just a billing error on their end. When they're filling out all this paperwork to bill Medicare for this, they're not using words, they're using codes. And sometimes if someone fat fingers a key, they'll put a wrong code in. So check with the provider first. If that doesn't work, you can call 1-800-MEDICARE and work with those folks. And of course, we love at SMP to get calls from beneficiaries if there's a problem. And our number is 1-800-892-0890. And we'd be thrilled to assist you to start to work through the problem. That's how we get most of our the case management work that we do, is people calling in saying there's a problem. And like I said, it can take a matter of a few calls. It could take a month. It could take a year to solve these. And these people that are doing the claims resolution, these people are pretty skilled at what they're doing. And if they are having trouble getting through it, I can't imagine a beneficiary who doesn't have, probably as much knowledge of the Medicare system as these folks to bring it to resolution.
Dennis, one of the things that kind of is crazy for me is about the time frame on these things, because frequently I don't get any kind of statements from Medicare or my supplemental insurance for months after I've seen the doctor. So how much time do you actually have to make any claims if you have something like that?
From the time that you get the explanation of benefits or the Medicare summary notice, you have 180 days to appeal to Medicare. And you're right, you get them every 3 months, and it could be months since you've been to the doctor and you're looking at this, and you may not quite remember exactly what was done. During the presentation that we're going to do on July 8th, we talked specifically about that, and we're going to provide a tool for you that'll help you keep that information all in one place. So you do have 180 days from the time that you receive the bill.
Can you give some examples? I know we just talked about the brace, but can you give some other examples of errors or fraud or abuse complaints that you receive?
Yep, sure. It could be, like we said, a billing error, primarily from a hospital or a provider. The durable medical equipment we get lots of calls on that. Questionable ambulance charges. If anyone is transported by an ambulance, take a look at that bill very carefully, because there's a whole bunch of different rules that have to be followed. Some follow them, some don't. Quality of care issues is another one. People who are discharged too early or to the wrong location, they may be discharged home as opposed to a rehab. So quality of care is a big one. The Medicare prescription drug plans, we get calls on that. as well as mental health services and dental procedures.
Yeah, it's really weird the way things happen with the prescriptions, because every year you get this huge booklet that comes in the mail that lists all the medications that are part of all these programs. And I know I have had a lot of trouble trying to find the medications that I take in these books. And the prices can change every year. And sometimes
Yes.
they even change in the middle of the year.
Definitely, definitely.
Do you work with other agencies?
We do. Again, we do work with Medicare directly. We work with senior centers and retirement communities. We've done a lot of presentations at those organizations. The Office of the Attorney General, if we think there's a problem, a legal problem with something. We work with the Office of Refugees and Immigrants, another population that may not be comfortable asking the kinds of questions or following up if English is not their primary language. There's also a group called the KeyPro, which is a quality improvement organization. And if people have questions about quality of care, either a hospital or a lot of times it could be home health care, where we get some of the calls about quality of care. We deal with other organizations, the AARP, with the Inspector General's office. Again, some of those we have to take legal action to get things moving sometimes.
And Dennis, are you a volunteer?
Yes, I am. I've been volunteering with Senior Medicare Patrol for about 4 years now, and have done many presentations across the state at senior centers or assisted living. I don't do any case management. There's another group of folks that do case management, and these people look at the claims, respond to the complaints, and follow them up to resolve the issues.
Okay, and people can volunteer with this group if they wanted to?
Yes, we're always looking for volunteers. As a matter of fact, some people will say, well, if I want to do claims resolution, do I have to go all the way up to Lawrence if I'm living down in Whitman? The answer is sometimes no. Sometimes some of these activities can be done over the phone. So if you want to volunteer, we have a volunteer coordinator, Caroline Cole, and her email address is ccole@esmv.org. That's ESMV, meaning it just speak about a senior moment. Elderly Services of Merrimack Valley, and they're up in Lawrence.
Well, I'm glad I'm not the only one that has those senior moments.
Exactly.
And,
So we're always looking for new volunteers.
I was going to say, could you tell us some of the opportunities, like if someone's listening and is interested in helping out, are there some?
Sure. Well, we're hoping that life gets back together real quick and we can start doing health fairs again and other senior events where a lot of vendors will show up, and we're one of the vendors, and we have a table there and talking about the SMP program and protecting, detecting, and reporting. Community educators like I am, counselors that can work with Medicare recipients to work through some problems initially before it goes to case management. Again, the case researchers and administrative support. So there's a number of different avenues that if you want to volunteer, this is a great place to volunteer.
Yeah, I had a gentleman the other day I was speaking to here in our center, and one of the things he mentioned that he, I mentioned I was going to be doing this, and he said that he gets a lot of calls about Medicare benefits. And he says, they tell you that Medicare won't ever call you and they won't offer this and offer that. But he's like, I get these calls. He's like, in his exact words, Joe Namath is on TV, he says, telling me about all these benefits. Yeah. So he was wondering about, these calls, are they legitimate? Is someone really going to call and offer these benefits over the phone to someone?
Well, one thing to watch out for is your caller ID. If you get a call that's coming in from 1-800-Medicare, chances are it is not 100. It is not Medicare. These scammers can spoof any number that they want, and if they can, I've gotten calls here from 1-800-Medicare, and because I do this kind of presentation, I usually pick up the phone to find out and to see what's happening. And as related to Joe Namath and those, it's very hard to read, but if you can get close enough to the screen and squint at the very bottom, it will indicate that it is not Medicaid that he's representing. He is representing private insurance. And when we do a full hour presentation on this, we talk about those specifics in much more detail and what to watch out for.
Yeah, that's like, you can also tell because the little bit larger print than the really small print will say a licensed agent. That means a sales agent for an insurance company.
Yeah.
Exactly. They use names you should call the Medicare benefits hotline. Well, you've got the Medicare in it. You think it must be Medicare then, but it isn't. It's private insurance.
Okay. And can I ask, lastly here, I have, if people want to learn more about this and get engaged and find out more information, what's a good way to go about that?
A perfect way of ending our conversation here. As a matter of fact, I'm coming to Whitman, to the Whitman Senior Center on Thursday, July 8th at 10 o'clock. And I'm going to do a presentation, full hour presentation on fraud, waste, abuse, becoming an engaged healthcare consumer. And I encourage everyone, this is in person now. We're getting back to the in-person and no longer Zoom. So I'll be there to do a presentation. And if you can't attend, you will be able, not may, Paul, you will be able to watch us on local television. Paul Watson at the Whitman Hanson Community Television Access Center will be taping the live event and then broadcasting it later on. Paul, anything on that?
Yeah, we don't want anybody to miss that. So
Right.
we will record it and do a little bit of post on it so people can see the slides and the presentation really well. And we'll be running it forever, like anything else that's on cable. It runs forever.
But we would like to see everybody in person. That would be great.
Definitely. And we are open, so everyone's more than welcome. Come and join. We can provide some snacks. That's always good.
It is. Food always helps.
And some great information. So we look forward to it.
Great. We'll look forward to being there on July 8th at 10 o'clock.
Excellent. Thank you.
Thank you very much.
Thank you.